Hi, welcome to this episode on diabetes and diet, our second in the series of Everything Diabetes. Now, for a diabetic patient, the diet is very critical in the management of diabetes. So, it's only important that we do a deep dive into this very important topic of diet with regards to management of diabetes. So, to do this, we have an expert who is the head of the department of nutrition and dietetics at Silverline Hospital, Mrs. Neetha Pratheep, who is with me to unravel the mysteries of diet and diabetes in this episode. So welcome to the show, Neetha.
Thank you, and it's my pleasure to share this platform, and I look forward to have more insightful conversation with you.
So up until now, we've been talking about carbohydrates, trying to keep the carbohydrates down, and the narrative has always been built around carbohydrates. But suddenly, both doctors and nutritionists alike, we've understood the importance of proteins, and all of a sudden we've started talking about proteins. So, can you tell our audience, what is this buzz about proteins just now?
Proteins are very important to us. Like protein helps for, it's act as a building blocks, and it's necessary for the tissue repair, and it's necessary for the overall health. And the ICMR, Indian Council of Medical Research, have recommended the protein intake at 0.8 to 1 gram per kilogram per body weight, but most of us consume less than that. But actually the synergy between the carbohydrate and protein is where the magic lies. Carbohydrate, if you consume alone, there is a tendency to spike the blood sugar. But
So you said, I liked it when you said the magic really works, and I've seen that in practice.
Yeah.
So every time we tell our patients that you need to combine these two, certainly it makes a world of difference, and I've seen it.
Difference.
So can you just throw a little bit of light on why this is magical all of a sudden, and we seem to have, like, the penny is dropped and we suddenly seem to have realized this. So what is that? And also, often when you use the words like proteins, our patients are sometimes left floundered. What is this proteins? How do you get it? And suddenly they think of they conjure up all sorts of images. So can you please throw some simple insights into where can somebody source these proteins as well?
Yeah. That's what, if you include carbohydrates with protein, how does this work? Because protein will slow down the digestion of carbohydrate, so it will reduce the sugar spike. Simple example, if you can say, for example, if you take idli, for example, idli we used to consume with chutney and sambar. But you can see that there will be a sudden spike in blood sugar and sudden crash also. You will feel hungry soon after. But the same combination, if you can combine with protein source like egg or pulses, you can see the difference.
Yeah. So let me just stop you there. You're right. I mean, that's a great way of looking at it, because so far, what I'd been telling my patients is that it's okay to eat idli, but have more of sambar, have more of chutney and all that. But I think from what you're saying, that by itself may not do, because in sambar, how much of protein? There's a little bit of dal, there's a little bit of vegetable, there's a little bit of this, that. Exactly. And even in chutney, there must be a little bit of fiber. Protein, but still, I don't think it will come anywhere close to, like, for example, as you suggested, add some egg or add some pulses along with this. Right?
Yeah, for the non-vegetarians, they can opt for egg. For the vegetarians, they can include pulses. So we can see the difference. When this combination happens, what will happen? The sugar spike won't be there, and the sugar crash also won't be there. So there will be a slow and sustained release of energy. So that will help the patients a lot.
Absolutely. To summarize what Neetha was trying to tell us is that always now it's just not about just looking at carbohydrates alone, but if you can toggle carbohydrates with proteins, and where do you get proteins? Like a good, every day you have an egg added on to your breakfast of, otherwise what would be a little bit or a lot of carbohydrates, or some pulses, right? Like some chana, boiled chana, or that's what you tell your patients.
If they want to consume oats, they can include nuts as a protein source.
Nuts can be included as well in the breakfast. So that's the magic. So remember, add proteins to the carbs, and you can kind of level this off, and ultimately you can prevent that sugar spikes from happening, isn't
Yeah,
it?
exactly.
So now that we spoke about the magic of adding protein to carbohydrate, another burning question that is often put to me, or I'm faced with, is this whole phenomenon of millets. I'm sure all of us have heard of millets. Why all of us? The whole world is talking about millets. So it's only right that we speak about millets in a little bit so that our audience understand, or our diabetic patients out there understands that everything that they need to know in a commonsensical manner about millets.
Yeah, that's what.
So
Millets are currently the hot topic of discussion, and you know that in the market, lot of millets are available now. Foxtail millet, little millet, poso, kodo. So for when I ask my patient like how to include millets in their daily diet, they're confused like what to choose. So it's better to take foxtail millet or little millet. That tastes better than other kind of millets.
yeah, so I'm told that let me just add a quirky element to this discussion. So I've heard that is when you and your husband, Dr. Pratheep, a neurologist, I happened to hear or chance upon your conversation, and Pradeep testifies this as well, that you used to send your regular Kerala breakfast or lunch with him, pack it off and give it to him when he goes to work. But he was always complaining that he was hungry towards evening or night.
And he used to eat at 11 o'clock. He used to have some snacks.
Correct. Yeah, obviously in the cafeteria there where it will be mostly junk and all that.
Right.
Yeah, and I'm told that once you decided to change his diet or the food that you were parceling or packing off with him into like a millet-based diet, and I heard Pradeep saying that lo and behold, he doesn't feel hungry in the evening. He doesn't have to raid the cafeteria there in the hospital, and he feels full right until evening.
Yeah.
And that was very insightful to me.
Yeah.
And after that, I also, based on what I heard, I started, having more millets in my diet. And I totally vouch for what you and Pradeep are saying, that the satiety factor of millets is very high, because I just don't feel hungry in the evening anymore. So can you just give us some more insights into millets in terms of the nutrient rich part of it, in terms of the fiber part of it, in terms of how all this together makes you suddenly fill up this. It is high on satiety, low on glycemic index, and so forth.
That's exactly, sir. Actually, the satiety feeling comes with the fiber. Millets are rich in soluble fiber and protein. So both combination are there. So if you take like a normal South Indian cuisine, if you can swap the rice-based breakfast with millets, you can see the difference, because it will digest slowly. So you will feel satiated for a long period of time. And in our hospital, Silverline Hospital, we have a dedicated team, and we started offering millet-based breakfast to our patients. And you can see, sir, significant difference. You can see their blood sugar level also, because of the low glycemic index.
Absolutely.
So that helps. That part millet plays important role.
Absolutely. So I think these are the reasons why millet has become a phenomenon in our country today and around us. So much so that our Prime Minister has been serving, or he's known to serve millets when he has dignitaries like heads of states over. He makes it a point to serve a kind of a millet-based or millet-theme-based banquet to these dignitaries. So our Prime Minister has understood the value of millets, so has all of us.
Last year was the International Millet Year. UN General Assembly has declared. Had declared in 2023 as millet.
Rightfully so.
Yeah, and to the best of my knowledge, we are the sole hospital in Cochin implementing this beneficial initiative.
I think so. But I wish that more and more people follow suit. Now that we've done two hot topics, let's cut to the present, and let's try and explore a very pertinent or very current topic, which is Ramadan fast. So we have helped scores of our Muslim brethren go through the Ramadan fast, and it's for a lot of them it's very important and very close to their hearts, and they need help going through this fast. So Neetha, can you just throw some light on what you think are the benefits of fasting during Ramadan and fasting as a whole?
It's a very relevant topic, sir, because these days people are doing Ramadan fasting and most of the people will be curious to know more about it. So fasting, a tradition ingrained in like our culture and religion, and it has gained important in recent days, not only because of their religious significance, but also because of the health benefits. We have got numerous articles which says that fasting, especially intermittent fasting, will improve their insulin resistance. It will help to control their blood sugar, and it will help to reduce their weight, which are the key factors in diabetic management. So coming to this fasting, sir, do you recall one article we have discussed during our journal club discussion time, that it says that intermittent fasting, it will help to improve the gut microbiome also.
Absolutely.
Yeah, it will help for the gut symbiosis and reduces the gut
I think also now we've started talking about autophagy. Autophagy is that the bad cells, when you fast, it tends to degenerate, and it's like a detox. Yeah, when you fast,
especially if you go
when you fast, your body cleanses itself to whatever extent. So I think it borders on autophagy, it borders on cleansing, it borders on detoxification. So I think all these things can be, seamlessly. All these things can be considered as benefits of
especially
fasting.
If they go for 14 and 16 hours window fasting, that especially if they go for that window period. And regarding the diabetic people,
and also I think in many ways what is also happening is that you are showing that you are in control of your body and your mind. So not only is it that there is a nutritional benefit, obviously there are plenty of nutritional benefits in fasting, but also do you think that it has many things to do with how in control you are over your body and mind, so that you're able to fast for the said period of time. So is there an element of that as well you see in your patients who wish to go through this fast?
I used to get a lot of queries about this intermittent fasting, but they used to have an early dinner and they will skip their breakfast and they will get a 16 to 14 hour of fasting, and they are happy with that.
And also what I felt is that every time my Muslim patients come to me, and 9 out of 10 want to go through this fast. So what this tells me is that they've experienced something special during these fasting periods, and so they wish to do it more and more. So in many ways, what I feel about these, when they wish to do this, is it's definitely the nutritive part is there, but more importantly is to do with their resolve over their mind, their control over their mind, and the time they spend in prayer. So when you are empty stomach, you tend to concentrate more, you tend to be more pious and all that. So I think it's a wonderful tradition of fast where, to my mind, they are able to control their mind, they are able to detox, and then this period they spend in prayer. So what a wonderful phenomenon.
Exactly. But for the diabetic patient, they have to do it with caution. They have to take an expert advice.
Absolutely.
Because most of the time, what I have noticed, some patient will go, there are chances for them to go to hypoglycemia.
Absolutely.
Dehydration, electrolyte imbalance, if they have underlying conditions like heart disease or kidney disease. So it's better for them to seek an expert advice.
I agree, Neetha. I'm glad that you mentioned that, because I was just going to say that, is that it's not for everybody. And I tell my patients that, look, God speaks through me. And when I say that this may not be safe for you to go through a fast. So most of the time I can see the disappointment, and however frail these people are, and however complex their diabetes is, but still most of them look forward to this fast, and to convince them not is not easy. But as a doctor, I have to do that, and I have to weed out or differentiate somebody who can safely go through a fast versus not, which I think is my duty, and I take that very seriously. And if I believe that one of my patients are not fit enough to go through a fast, I just clearly put it to them. And even if I have to say that, consider that God is speaking through me. And please, when I say no, it's not safe for you to go through a fast.
Yeah, so it's better to take an expert advice before going for this fasting.
I'd like to end this very interesting session on diet and diabetes by asking a very fundamental question to Neetha. How do you eat properly?
Yes, it's a very important thing. Like how to eat is also as important as what to eat. First, when you start consuming a food, you have to, the order is very important. You have to start with vegetables, then you can go for protein, then you can go for the carbohydrates. Usually what people will do, they will do it in the reverse order. They will take a lot of carbs, for example rice, and they will include protein, and fiber will be very less. So if you consume it in the reverse order, like to start with vegetables, then protein, then carbs, is that thing is very important.
Interesting.
Another thing, what always try to consume food in the natural form, because you know that whole wheat is always better than refined wheat. The broken wheat is better than wheat flour, or rolled oats and steel cut oats are better than the processed oats. And if you take in the example of corn, corn is nutritious, but if you convert it into cornflakes, it will lose all the fiber and the nutrients.
So it's like the barn to plate.
The barn to the plate.
So you go back in the food chain as much as possible.
As much as possible.
And go back to nature and source it from nature, or as close to nature as possible.
That's right.
Very,
and
very important message.
Take the example of fruit. It's easy to consume a fruit juice, but it is always better to go for fruit rather than fruit juice.
So I have a question there. So I'm often confused. I see a lot of our patients asking us about smoothies, and if you look at every diet recommendation or the slimming diets mainly, it's not complete without a smoothie. But I have my own reservations about smoothies, because as you were saying, you have the whole fruit and not the juice. So isn't smoothie really a juice? So then are we right in suggesting or advising smoothies?
I can recommend smoothies, but the combination is important. It should contain a whole grain, it should contain for protein in the form of nuts, and they can add fruits to that, so that smoothie itself can be balanced. So the way you consume is very important.
Interesting, because I think often our patients misunderstand or misconstrue smoothies as a juice. So they don't realize that there are cereals, the whole grain cereals need to come in, nuts need to go in. So it's generally a very balanced kind of a drink, and the fruit is a whole fruit basically, and you don't strain the fiber out of that fruit when you make it, isn't it? So what you're defining here is a smoothie is like a kind of a thick kind of a drink, which is wholesome in itself.
And you can make it wholesome by adding everything like grains, fruits and nuts into it. So diet is not about food deprivation. It's about nourishing your body with the right amount of food in the right way.
Correct. And also I think we did not cover a very important aspect of how to eat is the quantity. Isn't it? Because often people are under this misconception that even the nutritious food, or what we term as healthy, you can eat any amount. But I think isn't that something that we need to
matters a lot.
Set straight for our audience?
Quantity matters a lot, because in some cases I used to get patients, they used to skip their dinner and they used to consume fruits for the dinner. But if the quantity is on the higher side, it will spike the blood sugar.
Absolutely.
So the quantity also matters a lot.
Right. So I think if there is one message that our audience should take note or should leave with, is that It's not that you can eat nutritious food any amount or limitless. So, whatever it is, you need to be very, very cautious in the quantity that you eat as well. And that's the message that Neetha is giving us today. We've come to the end of a very interesting session on diet and diabetes. So please hit the subscribe button for more such information on everything diabetes. So until my next episode on everything diabetes, goodbye.